I've been doing endo for 10 years, and it's funny how a lot of other dentists here, things work and are okay, but you always have a little anxiety before the x-ray. But after the last couple of days, especially which I don't usually generally do, maxillary molars and other teeth, you just realize endo is a set of systems and the small little details. If you skip one, then it's going to lead to a poorer outcome. But now, after learning all those little steps and things that are in my scope of treatment too, the one I just finished came out looking beautiful, as good as an endodontist. It's a great treatment for the patient, and I felt kind of bad knowing now what I didn't know before. So it's definitely steps your game up and makes you a lot better clinician too, and efficient. Again, as I've learned, endo is just a set of like an algorithm of step by step, and I've learned all the steps now. And again, just to make things look great, get the link look good on the x-rays, and even use just the condensation methods too. So without a doubt, everything's really changed. For a general dentist, even with Coyce, unless he's sitting right next to you prepping 10 veneers and helping you get your bite, I'm doing a molar root canal, and the problems that happen in my office happen here, or I'm short, I can't find a canal, and then using Dr. Chopra's tips and tricks and the systems too that she talked about, then it's by far probably the best CEs doing it hands-on.